video? Informative. Anything else?
Well, because
anything else stood out?
even if he's like, we had 3.5 out of 4 stars, but he wanted 4 out of 4, so he recognized that there's still room for improvement despite their, positive scoring.
Right. Okay.
So,
anything else? Like I said, we're talking about quality today, and it's defined a few different ways. The Institute of Medicine defines quality as the degree to which health services for individuals or populations, that's important, individuals or populations, increase the likelihood of desired health outcomes and are consistent with the current professional knowledge. So with this definition, it basically says that quality involves making people more healthy, right? Increasing outcomes was another key word in that definition. Your book talks about Donabedian. Some will consider him the father of quality, or the person that first really started talking about quality in healthcare. And so, according to Donabedian, his kind of definition of quality involves structure, processes, and outcomes. So the structure being quality staff, but not just quality staff, but also quality facilities. So you can have a 5-star staff, but if your hospital is dirty and broken and things don't work, and your equipment is from 1940, are you really going to be able to provide good quality? Probably not. So that was the first thing. Then the process deals with quality processes, not only in management, but also the actual production of the services. So not only do we need to make sure that our managers are high quality managers and setting the metrics that they need to for their staff, we also need to make sure that the actual service that our staff is providing is of high quality. And then the last one, the outcomes, that's pretty self-explanatory. Outcomes are pretty much the outcome of what happens after the patient has received the services that you provide. So to continue with Donabedian's 4 parts, there's technical management, which is the management of the technical, equipment or the actual technical components of providing service. Then you have interpersonal relationships, amenities of care, and ethical principles guiding care. Now the one I want to stop and talk about a little bit is interpersonal relationships. Why do you think interpersonal relationships, why is that related to quality, or what does that have to do with quality?
well, there's a lot of friction in the facility between, say, nursing staff and administrative. That's going to eventually spill over into patient care, because the nurses are going to be irritated that administrators making them do this, that, and the other, and they're not going to get the patients the quality care, which can bring their quality scores down.
Okay, exactly.
So it's like a circle thing.
Okay, so yeah, you're absolutely right. Even if we break it down to just the staff level, and if there's friction between 2 nurses, is their focus going to be on providing care if they're too busy thinking about why they don't like this nurse, or why there's friction going on? So you're absolutely right. So interpersonal relationships are very important to quality, because we need to have everybody working together, kind of as the guy in the video mentioned, that at one facility it was like a campaign. So everybody was working together to try to provide a higher level of quality. Within quality, there's 2 questions that you should always think about. The first one is, are the right things done? The second one is, are things done right? Now, it kind of sound alike, so do you guys understand the difference?
Yes, because you can be doing the right thing, but you may not be doing it right, so it still makes it wrong.
You guys agree with that? Say that again.
You can be doing the right thing as far as you're paying your utilities, you're doing this and that, but if you're not paying it the right way, say with like illegal funds, it doesn't make it right.
Or, let's stay on that example, and you are paying your utility bill, but you're paying it 10 days late. Right?
Right.
All right, so to kind of piggyback off of what she's saying, you have to make sure that you can always check off both of these, and not just one, when you're thinking in terms of quality. You need to be able to check off, yes, the right things is done, and yes, it's done right. Does that make sense? All right, so there's a few different examples of how we cannot provide equality. We have underuse, overuse, and misuse. So I think a lot of times people think of maybe one or two of these, but not all three when it comes to quality. So we're going to talk a little bit about each one. So underuse is the failure to provide a service whose benefit is greater than the risk. So an example of this is maybe a mammogram or a beta blocker prescription. And it doesn't just have to be a beta blocker prescription. It could be a different type of prescription. So basically saying that we didn't do something when we probably should have. So we didn't check her at age 30, we checked her at age 40, and maybe we should check her at age 30 for breast cancer.
What about the care of patients that has insurance versus the ones that don't have insurance?
Okay, yeah, we could say, you're saying that maybe the patients without insurance get less care or underuse, right, because they know that they're not going to get the money back for all the procedures. You're absolutely right. We could look at that as an example as well. So that's underuse. Then we have overuse. So that was pretty self-explanatory. We could stick with your example and flip it on the other side. We know that she has experience, so we're going to test her for everything, right? Every single thing, even the things we know she doesn't have, we're going to test her because she has insurance, right?
Oh, she has great insurance.
She has really good insurance. So that would be overuse. And then we have misuse. And misuse obviously kind of deals more with errors. So we gave Mr. Bradley here penicillin when we should have gave him something else because he's actually allergic to penicillin. So which one's the worst? Which one is just terrible?
Misuse.
Misuse. Okay. Everybody agree with that?
Well, yes, actually, because it's not just misused by the providers or even the insurance companies, it's also the patients too. You have so many people misusing a certain service, it just makes everything look bad.
So you say overuse.
I say all.
You say all. She's right. The reason, the way we can answer this question is, can any one of these cause death?
Yes.
Yes.
Right. So knowing that any one of these can cause death, they're all equally bad, in my opinion. So you're absolutely correct. As I said in the beginning, misuse is kind of the one that gets the most publicity. This is the one we hear about the most in the news and the media. We don't quite hear about underuse and overuse as much as we hear about misuse, but they're all equally important because if you give someone too much of something, we all know that if you have surgery, and maybe you have too much of the anesthesia, you might die, right? That would be overuse. Or if you don't prescribe that drug they need in time or at all, they might die, right? So in my mind, as a healthcare manager, as a healthcare professional, if any of this stuff is gonna cause unfavorable reaction with my patient or result in death, it's bad. It's liability for me and my organization, right? Any other comments about any of these? Underuse, overuse, misuse? BALDRIGE Award is a highly coveted award, a quality award. So if you are researching hospitals, you're trying to choose between 2 hospitals to have your baby at or 2 hospitals to have your surgery at, if one of the 2 hospitals has this award, choose this one. There's a lot of work that goes into earning this award. So hospitals that do have this award, you know that quality is one of their top priorities. So the award criteria is based on strategic framework. So they look at the organization's mission, vision, and values. An organization that has quality as a top priority might or should have quality somewhere in their mission statement. Our mission is to provide high quality health care to Cumberland County residents, or whatever it may be. Usually hospitals that really focus on quality will have it somewhere in their mission, vision, and value statements. So they look at the strategic framework of the organization, they look at the structure, within the structure they look at the leadership, again the strategic planning, and the focus on patients and customers within their market. So they will look at the leadership team, they'll look at the CEO or the president of the hospital and see, is this leader encouraging quality? What type of quality initiatives have they been pushing throughout the organization for their staff to do? So they look at that stuff, they look at the actual processes, so what types of things are they doing to promote high quality? What type of goals have they set for each department? Where are the quality metrics coming back at? Are they in the 90th percentile or are they in the 50th percentile? So that all falls under the processes. And then the outcomes. How are their patients doing? Where are their numbers at? Are their patients being discharged and returning within 2 weeks because something wasn't done right? Or are their patients having really good outcomes? So the organizations that get a star by each of these are more likely to be in the running to receive the BALDRIGE Award. And there's a link here if you want to read more about the award and kind of which hospitals receive it and what they have to go through to receive it. This is kind of a diagram that shows you the BALDRIGE criteria. It's kind of what we just talked about. So number one, you have the leadership, and you see an organization is only as good as their leadership. So you see that leadership is number one right here, and everything kind of spews away from the leadership. It's very important that you have leadership on board when you try to do huge initiatives like a big quality initiative. And then you have the strategic planning, because we know how important that is, so it's number two. And then we have the focus on the patients, and then you have the staff focus, process management, and then the outcomes and the results. So this is kind of just a diagram that kind of illustrates what I just went through with the award. So some common quality elements. Obviously we have measurement. So within measurement, we have definition, reliability, and validity. So somebody give me an example of something that we want to measure in our hospital.
Patient's temperature?
No.
No.
A little bit more specific.
Maybe their vital signs, like
No, it has nothing to do with that. It'd be like how many patients you got, your growth.
Let's think more in terms of patient care.
Patient's death.
All right, we'll go with that one. So we want to look at the deaths within our, how many people are dying within our hospital. So that's what we're going to measure.
And how many of those are preventable?
So, right. So the first thing we're going to do is we got to define what we're measuring. So are we going to say, so by defining it, we would want to say that we are going to measure, it has to be very specific. So we would say we are going to measure patient deaths from, we could do like a month, 6 months, a year. So what are we going to do? A year, okay. So that would be in the defining or the definition stage. So we have our first thing. We've defined how we're going to measure it. The next thing is reliability. So now that we've defined it, we have to figure out how we make sure that what we measure is reliable, is rational. So what that means is we can't just go on, I can't recall what the name of the staff is of the person who comes in after the patient dies to verify that they died and they write down the time.
Oh, yeah.
Do we think that that would be a reliable way to make sure that that we're measuring our patient deaths?
No.
What do you think might be more reliable? The actual record, right?
I was just gonna say
If we look at the
records.
medical record, then we can know that, it's documented, so the medical record would ensure that it's reliable, right? The thing that we're measuring is reliable. And then the last thing we have is validity. So how might we make sure that the thing that we're measuring, which is patient deaths, is valid?
All documentation,
Again, documentation, the medical record,
lab results,
the results could actually go for both of these.
More.
And those would be things to make sure that it's reliable and valid. So whenever you're measuring, whatever it be, patient deaths, diabetes, heart attacks, strokes, patient falls, whatever it may be. You have to make sure that when you're measuring it, you can define it, it's reliable, and it's valid. If it's not one of these, then it's probably not a good measuring tool. In some instances, when we're measuring quality, it'll get very specific and kind of over some of our heads. Well, they'll actually use statistics to kind of measure and document what type of quality measures are going on in the hospital. Most hospitals have a separate quality department that really focuses in on this stuff. So as a department manager, it's not something that you would necessarily have to know how to do, but you would just need to know how to understand the results. So if you get that report, you got to be able to read it and understand what it says. But between the quality department and most hospitals also have a decision support department that generates all of this data. Those two departments will create reports that the managers will review with their employees to say either we did really good this month or this year, or we did really bad and this is where we need to be. So we'll stay on your example of patient deaths, and let's say that we reviewed our year and our scores weren't that good, and so the next year we made that one of our strong initiatives that we're going to improve patient deaths, and we did it. We hit our metrics. So it doesn't just stop there. You have to continue to improve. So if we hit our metrics and they were at the 75th percentile, a high quality organization is going to say, next time we're going to hit 80th percentile. So quality has a lot to do with continuing to improve. And even once you get to that 100% mark, a good quality organization is still going to be trying to figure out better ways to make improvements to their quality. Again, Donna Median kind of had an opinion or a definition of continuous process improvement. And here were the 5 dimensions that he thought were most important. Process focus, so you definitely need to be focused on your process. You gotta be focused on your customer or the patients. Again, database decision making, I kind of just talked about that, how important that data is. Employee empowerment, so everybody has to work together. And then organization-wide scope. So what that means is if the surgery department is working on a quality initiative, it shouldn't stop there. That surgery initiative should be something that everybody in the organization knows about, even if they only affect the initiative indirectly. So it needs to be organization-wide. Focus and PCDA are acronyms that stand for things. Does anybody know what either one of these stands for?
That's fine. Organize, clarify, understand, and select.
Okay, very good. And what about PCDA?
Plan, do, check, and act.
All right, and these are both, you'll probably hear the PCDA or PDCA, it goes both ways depending on who says it. That one you'll hear probably in more than just this class. It's a pretty popular model that basically helps you to understand how to approach an initiative or a problem. So if we do the focus one first, as she said, the acronym stands for find, organize, clarify, understand, and select. So the find basically means we have to identify what the problem is. And once we figure out that our patients are dying, then the next thing we need to do is organize. So we probably need to put a team together to work on it. So this is our team. And then we have to clarify what are we going to do to fix the problem. And these are just 2 examples that you might use, but they're not the only 2. You can use more than just these 2 techniques to try to get more clarification on the problem. Then we want to understand. So we have to measure and collect the data. So again, it might include some review of medical records if we wanted to kind of count all the deaths. And then select is, once we've counted all the data, then we have to figure out what processes are we going to do and put in place to make sure that our numbers aren't this bad next year. And kind of the same thing goes along with plan, do, check, act. It's a little different, but kind of the same thing. Your first step is to plan, and then the next step is to actually do what you plan. And then after you do what you planned, you want to check it or evaluate it to see how it went. And then act is either you're going to start all over again because it didn't work, or you are going to continue to implement what you did because it did work. Six Sigma. Has anybody ever heard of Six Sigma? You know anything about it? You just heard about it?
I heard it, and I can't remember
Um,
exactly what it was, but I've heard it.
It deals with, it's kind of new to healthcare. It's been in other industries a little bit longer than healthcare. Toyota is very popular or famous for implementing Six Sigma within their organization. It focuses on being very efficient. So if there's a way to do something quicker but still at a high level of quality, that's what Six Sigma tries to achieve. And so if we stay on the example of Toyota, you think in terms of Toyota, they've been a fairly successful company. Well, a lot of people may ask why, and this is part of the reason why, because they've mastered Six Sigma. They've learned how to make really good products and cars while also keeping it at a low price for people to still be able to afford it and still put out a good product, a car that's safe, and all that. Yeah.
I just had a test on that, and I think it helps reduce the defects
Mm-hmm.
in the manufacturing.
Mm-hmm. What class was it?
Management, principles of management.
Yeah, so you're absolutely right. It also focuses on being lean, cutting waste. So I've participated in projects within the hospital where we use Six Sigma to cut back on our supplies. We were using way too many towels or sheets, or we were using way too many, maybe the facility staff was using too many napkins to clean up, whatever it may be. You can pretty much apply Six Sigma to any department within an organization to try to cut waste, to make it more lean, like I said, to make it more efficient. A common quote or saying that goes along with Six Sigma is work smarter, not harder. So Six Sigma focuses on how can you work smarter, but also be efficient with it and not waste. So like I said, it's kind of new to healthcare. It's been in other industries, like you said, manufacturing, automotive industries, a little longer than healthcare, but recently, kind of as a result of cutbacks in financials, as well as a bigger push for quality, the healthcare industry has really kind of embraced Six Sigma because they've had positive results with it. So there's a lot more healthcare organizations and hospitals now that are implementing, not just hospitals, but also pharmaceuticals. I have a colleague that does Six Sigma with one of the major pharmaceutical companies. So a lot of different organizations within healthcare are kind of using Six Sigma to their own benefit to save money, save time, and just make their organization a higher producer and more efficient. So we have another acronym here that kind of goes along with Six Sigma. It's define, measure, analyze, improve, and control. Define, we've kind of talked about, basically involves figuring out what your scope of work is going to be, putting down your time frames, how long it's going to take for you to do it. Then you always want to measure. In all of these acronyms, we've talked about measurement because it's very big in quality. You want to analyze. So after you've collected the data, you have to figure out what it means. And then you have to figure out what steps you're going to do after you've figured out what the data means. And then control is kind of important because after you've gone through all these steps and figured out what the problem is and how to improve it, you then have to control that to make sure that, as we talked about, you continue to improve and that you just don't kind of stay at a plateau or at a status quo. So you might say, you know, this is kind of complex, it seems like, but there are tools that can help you to do these quality metrics and measurements. And here are a few. So when we're collecting the data, you can use a check sheet, you can use charts or workflow diagram. And again, these aren't the only three. There's plenty of ways you can collect data. You can go old school and just write it down on a piece of paper. A lot of organizations now have computerized or automated ways to collect data. And then you can use a flow chart for process mapping. Again, there's other ways that you can do process mapping outside of a flow chart, but this is probably one of the most popular ones. And then for process analysis, you can use a cause and effect diagram, and there's also the Pareto chart or diagram that you can use. And again, there's several other ways that you can analyze processes as well that aren't listed up here. And so that is pretty much my spiel on quality today. Does anybody have any questions about what we talked about? Quality is something that's going to be very important. It's going to continue to be important, as the video talked about. There's a big push, especially for physicians and providers, to kind of come on board with quality, because as organizations are becoming more transparent, a lot of this stuff is being posted online now. So consumers can see what hospitals are high quality and which ones are not meeting those quality metrics. And nobody wants to be at the bottom, for everybody to see them at the bottom. So there's going to be a big push for quality moving forward. It's going to continue to be more of a push moving forward. And there's physicians now that are being paid for quality. So they're being incentivized to, work at a high quality level at some hospitals now. So if not, you guys enjoy your break, and I'll see you guys on Thursday next week. Yes, sir.
Are you doing the hospitals around here that got that ball with you?
I'd have to,